Good afternoon, and thank you for coming to our first signing ceremony. I also want to thank President Blaisdell, Speaker Galt, Senator Fitzpatrick, and Representative Nolan for being here today. Thank you. Since March of last year, we've faced a public health and economic pandemic. More than 96,000 Montanans have been infected with coronavirus. More than 1,300 Montanans have died as a result of this virus. Montanans have had to close their businesses. Montanans have lost their jobs. Montanans have lost their paychecks. And through all of it, Montanans have been resilient. On January 5th, I addressed how critical it is to protect businesses, nonprofit organizations, places of worship, healthcare providers from lawsuits. And if they make a good faith effort to protect individuals from the spread of coronavirus and follow clear public health guidelines. I underscored the urgency of getting this common sense bill to my desk, and the legislature delivered. On January 5th, Senator Fitzpatrick introduced SB 65, and within a month, it has cleared the legislature with bipartisan support. I want to thank every legislator, Republican and Democrat, who recognize the importance of protecting businesses, nonprofits, and others that protect their workers, their customers, and their clients. Senator Fitzpatrick, thank you for your leadership. Would you like to say a few words?
I would. I'd like to, first of all, thank the governor and his crew for the work they did, and especially with the leadership team. I know Representative Nolan did a great job for us, but also Senator Blaisdell and Speaker Galt and everybody else in the leadership team. To me, this is really an important bill. It's about getting people back to work and getting our economy open. And I think if you look at the bill, it's a forward-looking bill. It provides liability protection to prevent frivolous lawsuits, but it also provides a defense to ensure those people that are making good faith efforts to comply with local health guidance are protected from those lawsuits. So I think this is an important step for ending the COVID crisis and really getting Montana back on track. And I want to thank the governor for his leadership on this. It really made a big difference in getting it to the finish line here.
Thank you, Senator Fitzpatrick. I also want to thank all the businesses, nonprofits, and others who have supported this effort, including the Montana Chamber of Commerce, the National Federation of Independent Businesses, the Montana Retail Association, the Montana Restaurant Association, the Montana Building Industry Association, the Montana Bankers Association, and many others. This is a significant step in getting Montana safely open for business. These protections are common sense, and they'll go a long way to getting our economy going again, promoting the public health and shielding businesses, nonprofits, and places of worship and healthcare providers from coronavirus-related lawsuits as they work to protect Montanans. I'm proud to sign SB 65 into law. My pens are going apart. Senator?
Thank you.
Speaker?
Thank you.
Representative?
Thank you.
Mr. President? We are making great strides in combating this public health and economic pandemic, and SB 65 will help in those efforts. Our trend lines remain promising. Cases of infection have been trending downward. Coronavirus-related deaths have been trending down, and hospitalizations have been trending down. And with our vaccine distribution plan that prioritizes and protects the most vulnerable, we are saving lives. We're putting the most vulnerable Montanans at the front of the line for safe and effective vaccines. Montanans who are 70 years of age and older, Montanans with severe underlying health conditions like cancer and heart disease, and Native Americans and other persons of color who are at higher risk of severe complications. As of today, Montanans have had administered nearly 150,000 doses, and more than 41,000 Montanans have been fully immunized. And long-term care facilities and nursing homes have had at least one vaccination clinic. We're getting shots in the arms of Montana's most vulnerable. When they're able, I encourage all Montanans to get a safe and effective vaccine shot. And while we have seen a modest uptick in the number of vaccines the federal government is sending to Montana, it's still not enough. We have proven over and over again just how effective we are in getting the vaccine out to the most vulnerable. And I will continue asking the federal government to send Montana our fair share of doses. We will continue to make progress, and I remain optimistic and confident that we will get through this pandemic stronger on the other side. Montanans have shown just how resilient they are. Neighbors help neighbors. It's what we do. We support each other, and we care about each other. For nearly the last year, I have emphasized that I believe Montanans will do what it takes to take care of themselves, their loved ones, and their neighbors. And we have. I've also emphasized that to combat the virus, providing incentives and promoting personal responsibility are more effective than imposing impractical government mandates. On January 5th, I laid out a clear path to rescinding the statewide mask mandate. First, we need to start getting the vaccine to our most vulnerable. We have done that. Second, we need to protect businesses, nonprofits, places of worship, and healthcare providers from lawsuits if they make a good faith effort to protect individuals from the spread of the coronavirus and follow clear public health guidelines. We have done that too. As a result, I will provide a directive on Friday morning that will allow the existing statewide mask mandate to expire. Local jurisdictions may still choose to implement local mask mandates, but the state will no longer have one. As I've said, we will continue to provide incentives to protect the health and safety of Montanans, and we will emphasize personal responsibility over mandates. Since we're not out of the woods yet, I will continue to wear a mask, and I encourage all Montanans to do the same to protect themselves, their loved ones, and their neighbors. When it's my turn to get a vaccine, I'm going to get one, and I encourage all Montanans to do the same. Because when it comes down to it, I trust Montanans. And together, we can combat this public health and economic pandemic with personal responsibility and by looking out for one another. Thank you for being here today. And we have a few minutes. I'd be happy to take some questions for myself or the senator. Holly?
Governor, I wanted to ask, what sort of metrics led you to feel we've vaccinated enough people in that phase when you look at the vaccination numbers today? It looks like we're up over 40,000 total people fully immunized in Montana. But what numbers were you seeing in terms of people in that one group population? Like, how were you able to reach that decision?
Yeah, so appreciate the question. I laid out the criteria early in January that we really needed to get the vaccine to the most vulnerable with the completion of the first clinics at all nursing homes and long-term care facilities, and the downward trend in deaths and new positive tests. These were some of the factors, as well as this important legislation that I signed just today to provide protection from lawsuits for businesses and nonprofits. Yes.
Hi, Governor. I'm wondering, you just mentioned that you intend to continue wearing a mask. When will you feel comfortable no longer wearing a mask in public? And what do you think people in Montana should no longer wear?
Well, I am excited for the day that I can take my mask off for the last time and throw it in the trash can and go on with life safely. I think most Montanans feel that way as well. We'll continue to watch the data as it comes in. I'm just encouraged by the progress we've been making, especially in getting vaccines in people's arms. Sir, Jonathan?
Governor, I just wanted to ask, you said the new directive is going to come out on Friday. When will the change take effect? Will it take effect on Friday?
Yes, so thank you, Jonathan. Yes, with the new directive on Friday, the existing mask mandate will expire at that time. It will be replaced with, there's still a whole bunch of existing directives out there. We're rationalizing those. We're going to simplify them, and we'll recommunicate the ones that are in place. But the mask mandate will expire on Friday.
Just one other quick thing. Schools, the mask mandate, I think the mask mandate specifically referred to schools. Is that on the school level also going to be renewed?
Those decisions are made by local school boards. We'll continue to provide clear guidelines so they can make decisions to make sure our schools stay open and stay safe. Holly?
Looking at the population in phase 1B, I know it was 70 and up, it was people 60 to 69 with health conditions, Native Americans. We've seen these clinics, and there's one in Missoula this week where the appointments were gone in a matter of 4 minutes, I think. But are you worried that there's still a lot of people that are vulnerable in those age groups that the CDC's defining as vulnerable that still haven't been able to get vaccinated yet?
Well, I'm encouraged by the progress we're making. We did have a surge in vaccines this week because of the reallocation from the unused doses for long-term care facilities and nursing homes. I was on a call this week with the White House. They expect increased vaccines to be in modest increases over the next couple of weeks, and we're hopeful that we'll see this Johnson & Johnson vaccine approved for emergency use by the end of the month. So that provides promise as well. Thank you so much for being here today.